How you doing?
Good,
Good, I'm doing well. Okay, so we've got new sanitizers up here. Eric, what's the deal with that? Taylor, what's the deal with our new sanitizing
I
stuff up here?
slipped it in.
Oh, that's from corrections?
Yes.
Okay, very good, Scott. Thank you very much. Appreciate it. Well, welcome everybody. Thank you again for attending our afternoon update with regard to what the state is doing to prevent the spread of coronavirus here in Nebraska. And as always, I'm going to emphasize that we want people to continue to practice social distancing, physical distancing, thank you Stan Klaus, that we are doing, and all the other things that will help make sure we slow the spread of the virus. And of course, this week and for the next 3 weeks, we're going to continue to focus on stay home, right? We start off the week by talking about stay home, stay healthy, stay connected. And then yesterday we talked about our 6 rules for staying home and keeping Nebraska healthy, right? So this is around work, but work from home, and stay socially distanced if you're working, if you have to go into the office place. Stay home and don't have any unnecessary trips outside the home. Shop, but shop once a week, and don't take the entire family. Be efficient about it. Those are the first 3. The 4th is help kids socially distance. So that means have the kids play at home, avoid playgrounds and group sports. 5th, help seniors. If our older Nebraskans need somebody to go shopping for them, that's a great way to help them stay at home. Or maybe they need errands run. But don't go visit a long-term care facility. And then number 6 is exercise at home or with an appropriate socially distanced exercise program or something you're going to do. But again, keep that social distance. Those are our 6 rules for Nebraskans to stay home and stay healthy. And of course, we're really focusing on the next 21 days. 21 days, we're day 1 of the 21 days to be able to stay home and stay healthy. So we want to continue to remind folks about that, and you will continue to hear about that throughout the rest of the month of April. Now, the first thing we want to hit upon, we talked about this last week, is the Google data, which tracks mobility. And we've got some good news from last week to this week with regard to improvements. So if you look, for example, with regard to retail and recreation, it's down 40%. Last week, we were down 36%. So we've seen improvement around this. Grocery and pharmacy is down 8%. It was around 9% down 9% last time. So, but still close in the category. Parks are only up 56%. So again, talking about if you go out, make sure you use the appropriate social distancing. And then I can't quite see it because of the way you set this up, Taylor. Hold on. Okay, let me just move these back a little bit. Okay, that's better. So, and then with regard to transits, in transit stations, probably not as important here in Nebraska as someplace like New York, but down 25% versus down the 18% it was last week. So again, improvement there. Workplaces down 27%. So again, this is people spending time in workplaces, the hours spent in workplace. That was down 24% before, so we've seen improvement there, down 27%. And then last week, you may recall, we were at plus 8% staying at home, and now we're up plus 9%. So again, heading the right direction there as well. So improvements in many of these categories with regard to the Google data. And this is just one of the ways that we can think about how are Nebraskans responding to the calls to do that social distancing, that physical distancing, and you can see that Nebraskans are making progress. So again, we want to continue to focus on 21 days to stay home and stay healthy, 12 rules to stay home and stay, the 6 rules to stay home and stay healthy that we just covered. So we want to continue to emphasize that and have Nebraskans think about those 6 rules. Next, we had a number of questions with regard to corrections and what we're doing with regard to the pandemic and the pandemic plans and so forth. So in a minute here, I'm going to call up Scott Frakes, our Director of Corrections, to talk about this. Now, what we have seen from Nebraskans is people coming together from both sides of the aisle to be able to address this public health emergency we have here in the state. What we've seen in Washington, D.C., though, is that some people have used this to push their agendas, whether it's vote all by mail or the Green New Deal or whatever. Here in Nebraska, we've had a small minority of people who have been pushing to release inmates early. This is something that has been going on for years here in the state, that a small minority of people have been pushing to release inmates early. First of all, the vast majority of Nebraskans do not believe that inmates should be released early. And when you think about that concept, it's really kind of irresponsible. Because if we release inmates early and they haven't gone through the programming necessary to be able to make sure they won't reoffend, they are much more likely to reoffend and just be back in the correction system. And that doesn't do anybody any good. And also, if you release inmates early and you release them without the resources to go back into the community, and they don't have the proper supports there, they are more likely, more at risk to, for example, get infected by the coronavirus, spread the coronavirus, and frankly, they will have the healthcare facilities available in our correction system that they may not have out in the community. So for everybody, we're just way better off that we continue to make sure we're taking care of our inmates, and Director Frakes will talk about that plan for what we're going to do with regard to the correction system. Now also, it's important to note in the correction system, we have continued to ask for money from the legislature to expand our capacity. In fact, we've asked for $170 million the legislature has given us. That's allowed us to add on about 260 beds, with another 100 beds that should come online this fall, with another 400 some beds that are scheduled to come over the next couple of years as we complete the construction of those. So we've asked for the resources to continue to expand that corrections facilities. The legislature's given them to us, and we continue to expand it. And that's not the only area. We continue to expand in other areas too, whether it's security and maintenance, investing in our teammates, all those areas we continue to invest in our correction system to be able to do it. And also, it's also important to note that we have the lowest rate of incarceration here in the state of Nebraska than any of the surrounding states. So we have a correction system that is taking care of our folks, that we have a plan for how we're going to deal with the corrections, or with the pandemic that we're facing right now. And Director Frakes will come up and say a little bit about that. And then I actually have some other things that we're going to update on, and then we'll get into questions and answers. So, but before we do that, we'll go ahead and bring up Director Frakes to say a few words about what our plan is with regard to this pandemic and corrections.
Thank you, Governor. Good afternoon. So these are incredibly challenging times, but I am truly glad to be here in Nebraska and part of one of the best state-led pandemic responses that's happening in America. The work of my agency draws little attention when it's done well, although most of our work is done extremely well. Over the last 5 years, we've reduced staff turnover, increased staff wages, decreased violence against staff, implemented leadership training and staff engagement, and a staff engagement partnership with Gallup. We've trained staff in and implemented process improvement techniques. We're using data to drive our work. We brought in and implemented evidence-based practices, including risk assessment tools and cognitive behavioral interventions, or CBIs. We've greatly expanded inmate programming and treatment opportunities, vocational training, life skills, CBIs, violence reduction, and privately funded programs like RISE, York College, and Prison Fellowship. We built a reentry program that starts when people enter prison. We're working hard to engage people in preparing for a successful return to the community. We now provide 30 days of prescribed medication to everyone that's releasing and 2 refills for affordable generic drugs. Everyone releasing is given the opportunity to obtain Nebraska ID or, whenever possible, a driver's license. We're working hard to give people the tools they need so they can be successful when they leave our system. And as the governor mentioned, to help address our bed space needs and our infrastructure needs, we've gotten funding for over 800 beds and some other significant prison improvements. I've announced the need for additional construction, and in the months ahead, I'll be working hard with many stakeholders to craft the right solutions for Nebraska. Despite the pandemic and the 24/7 focus on keeping people safe from COVID-19, our day-to-day work can't stop. About 200 people return to the community each month, and it's going to be difficult for people to find work, housing, and community resources. So now more than ever, we have to do all we can to give people the tools and the support that they need to be successful when they return. So what have we been doing to flatten the curve with COVID-19? So in early December, it appeared that we were going to have a pretty difficult flu season. Well, fortunately, we have a pandemic plan. We've had one for years. We got out our pandemic plan. We began talking about how we were going to respond, started shifting mindsets, looking at our practices, looking at our inventories, making sure that we had the supplies we needed, and getting prepared. Fortunately, the influenza A, influenza B season has pretty much wound down, at least for us it appears to. Our last case was several weeks ago. But that pandemic plan gave us the tools and the guidance we needed to manage that well. And fortunately, as COVID-19 then rose up, we were already thinking about pandemics. We were already using our plan to address one issue. It was a pretty easy shift for us to move towards COVID-19. On February 25th, we started issuing information to staff about COVID-19. By March 16th, we had opened our Emergency Operations Center so that we could have an agency-coordinated response to COVID. We are following the CDC guidelines for correctional facilities. There are 3 key points: prevention, operations, and medical. For prevention, one of the things that we implemented very early on was visitor and staff screening. Within a few days, we stopped allowing in inmate visitors, but we continued the staff screening, starting with first self-reporting and then expanding that to a questionnaire. And now we were finally able to get some digital thermometers, so we've now begun taking the temperature of everyone that comes into all of our system, not just our prisons, including the office building that I work in. Early on, we asked jails to communicate with us prior to sending anyone that was symptomatic. And much like our relationship with all the jails across Nebraska, they were very responsive, very supportive, and we have not had any issues in that respect. We have just finally been able to put together a good solid quarantine approach for new people coming into the system. So we now have quarantine locations at all of our intake centers. They all receive medical screening upon arrival, and then they receive checks twice a day for 14 days. At the point they're not symptomatic, then we'll move them into if they don't present symptoms, we'll move them into the general population. We looked at separating vulnerable populations, and specifically we're able to separate our geriatric population at NSP and the mothers, children, and pregnant inmates that are housed at NCCW. We've made sure that we have the personal protective equipment that everyone needs and have been able to continue to add to that. And at this moment, we're at the last stages of putting all of the inmates in a barrier or procedure mask. So we have, if you see behind me, we have the orange cloth mask that's available for staff. They can also use a personal mask if they choose to. We have gray masks that match the clothing for the inmates that are at community correction centers, and then we have khaki-colored masks for the people that are in the rest of our prisons. And we're expecting everyone to wear those masks when they're outside of their cell, house, wherever their bed might be. Sanitation. We knew that was a huge issue. We were already working hard on that because we work on it hard all of the time as a prison system, but with the flu epidemic, we wanted to make sure that we were kicking it up a notch, and we took it even farther. We expanded the use of bleach solution. Bleach is something you have to control in a prison because it can be dangerous, but the need for good sanitation outweighed some of that risk. So we've been using the CDC recommended solution of bleach. We incentivized our inmate porters or inmate janitors so that we could expect better performance from them, and if they wanted to continue to work and get the incentive, they needed to give us that performance. We've set up daily by shift reviews of sanitation, which are documented and sent to the wardens and to other administrators. We gave all of the inmates, this is about a month ago, we gave all of the inmates free bars of soap, and we've continued to do that, and we intend to continue to do that. And then we were finally able to get all the pieces necessary to make hand sanitizer. The governor's been talking about our hand sanitizer now for a while, but we were able to give that to all of our staff. So bar soap and water available to all inmates, hand sanitizer as well as soap and other washing facilities for staff. And we sanitize all of our vehicles, both the ones used by staff for general use and any vehicle that's used to transport one of our inmates. Last piece of that for prevention is social distancing. We began implementing that in every location. Yes, it can be challenging in a prison setting, especially in a dormitory setting, which we have a fair number of inmates who live in dormitories, but there are ways to ensure that people maintain as safe a distance as possible. And then now we've given them the mask, so that's just another tool that will help in terms of stopping the spread of airborne droplets. We've looked at programming, meals, a variety of different things, and done adjustments, shrunk numbers, or just stopped different things because we knew we just couldn't provide a reasonable amount of social distancing. On operations, one of the most critical pieces of managing any emergency is communication, which fortunately the man I work for models it as well or better than anybody I've ever seen. And I'm not saying that just because he's standing behind me. So I don't think we're quite hitting the bar he sets, but we're doing, I think, an excellent job. We have ongoing communication to staff, to the inmate population. I do videos, I do memos, I do other communication networks. We do a daily phone call with all of the wardens. It's part of our emergency operations center. We use social media so that the videos that I produce or written material that I produce is accessible to family members. And then if you go to our website, you'll see that we have a pretty substantial amount of information about COVID-19 on our website. We've done signage throughout the facilities and all other work areas to remind people about washing their hands and how to check their own symptoms and the things that they need to do. The inmate tablets we've used to put information out and put that again in the hands of the inmates. We're using anything we can think of to get information in front of people and help them to take it in. Again, just like when we started with the pandemic in December, or the potential pandemic, fortunately it wasn't one, but our influenza response, we went back, we made sure that we had good food inventories and actually took them up a little higher because we just saw the potential that there could be some supply chain challenges. So we got ahead of that. We also did that with paper supplies because if we need to if we need to provide meals on paper products, as we call them, we need to make sure that we've got enough of that we can do that. Also, we made sure we had plenty of toilet paper because that's a very important thing in anyone's world and certainly in a prison. We had to continue, as I said earlier, do some level of programming, provide opportunities for work, some recreation, do all of that while figuring out how we could maintain social distancing and keep everyone safe. We've done an excellent job of shrinking those numbers down below 10, of redesigning stuff. We also have some of our providers are now using web-based services to deliver programming. So we've done a lot of things to make sure that we still give people the things they need so that they're ready for release and do that safely. As I said, we had to stop visiting. That was a big move, and I think that was March 12th, if I remember right, because that's such an important component of maintaining that family offender bond, and it's an important component in the health of a good prison system. But we knew it was the right thing to do. What we were able to do is we expanded access to the phones, so we doubled the amount of time that people can be on their tablet phones. The provider GTL was nice enough to give our population and populations across the country free phone time, and they continue to do that. We were able to implement a videogram system that's tied to the JPay tablets, and that appears to be fairly popular and seems to be going fairly well. Video visiting, unfortunately, we're still running into technology issues. Video visiting is a big bandwidth consumer, and our facilities just aren't set up well for that. But we're not going to give up on it because at some point, I know that would be a really valuable addition. So think about this. We're all asked to quarantine in our houses. Fortunately, we allowed a little bit more movement than that, but for many, they're in their home. So think if you were told to quarantine in your bedroom, and that was the space that you needed to stay within. And that's basically what we ask of the populations, here in our jails across the country. So that's why it's so important that we figure out how to provide every safe opportunity to give people out of cell time for as long as we can, as long as it's possible to do that. It just will lead to better outcomes. The third point from the CDC plan, medical. So we have plans for quarantine and for isolation and responding to people that are symptomatic or that actually have been diagnosed with COVID-19. but it's confidential information. It's information that we need to keep within a small circle of people. We make sure those that need to know do, but it's information that can cause problems. If you look at some of the incidents that have happened in other facilities around the country just in the last week, one of those in particular was driven specifically by inmates that were upset that they were being told that they had to move from their housing location so others could be put into what they consider to be their house. So that's just one of the reasons that we have to manage pieces of our COVID plan, our emergency response plans, very closely. We have great access to community health care, and here again, because of the wonderful job we've done in Nebraska of flattening the curve, there is still ample resources in the community to meet health care needs for all of us, as well as my population, the people I take care of. People often think that we run hospitals. We do not. Very few prison systems in America actually run true inpatient or hospital level of care. We run skilled nursing facilities. They're licensed at the same level as a nursing home. So we're able to provide a significant amount of care, but if there's a need for community hospital care, we will transport our people to those beds, and the beds are there to be used. We do not have ventilators because, again, you need an inpatient or hospital level of care to operate a ventilator and all the resources that go with it. What our system does have is over 200 healthcare staff and 130 mental health care staff full-time. Those are filled positions. I have more positions at that, but those are actual staff that are on working for us, and we have contracted services as well. I honestly believe that right now we're offering greater access to health care than many, if not most, citizens can get to right now. Because it's there, it's available on a daily basis. Health services will screen all who self-report symptoms, and COVID-19 testing will be completed as medically indicated. And on testing, we do have some antigen testing resources on hand. We've got more on order, but we also have really good community provider support, so I'm not concerned about getting testing when it's medically indicated. We also have some antibody testing resources on hand, but that's kind of the after-the-fact piece. So it'll have value in time, but right now it's the antigen testing that's the most important piece. Thankfully, my staff members continue to come to work, and they come to work with great attitudes. They're doing amazing work. I can't tell you how proud I am of them and how much I appreciate everything that they do in this most difficult situation, and how they've responded, because, as you know, sometimes the changes come more than once a day in terms of direction or information or whatever it might be. And they've just done a really good job of being flexible and moving in the directions needed. We still have no confirmed cases among inmates, no inmates that are symptomatic. We have had one staff member that had a positive test result. That person has now been at home for 15 days. I think this speaks to the precautions that we implemented early on and the focus the agency has placed on taking every step possible to flatten the spread of COVID-19. Corrections is a business that embraced detailed emergency response planning over 35 years ago. We plan, train, drill, revise, and repeat. Our daily world operates around a simple emergency response concept: detect and notify, isolate and contain. We've done an exceptional job of keeping COVID-19 out of our prisons, and we're not going to let up on our efforts. Thank you.
Thank you very much, Scott. I appreciate that in-depth review of what you're doing and all your great work by you and your teammates to be able to care for the inmates that we're responsible for, but also keep the public safe. So thank you very much for all that. Just as we kind of wrap up this part two, I had made some remarks earlier with regard to violent versus nonviolent folks in our correction system. We've got about 3,500 people who are violent offenders in our correction system. We've got about 2,000 that would be considered in that category of nonviolent. In that nonviolent category, we still have very serious offenses like violating protection orders and blackmail and so forth. And of the drug offenders that would be considered in that nonviolent area, the average number of convictions they have is 19. So again, these are people who have had serious offenses and are in our correction system for a reason. And that's why we want to keep them there until they've had the opportunity to go through the programming and are ready to be paroled. Now, Taylor is also going to be handing out some information here after we get done with our press conference today on what our population looks like, especially given the folks around parole, because there's been criticism that we aren't paroling people fast enough. So that will have some more detailed information about who is actually parole eligible. And let me just give you kind of a ballpark number. These are numbers for as of December. So we'll get an updated number for the first quarter here. But just using the December numbers, if you look at the not quite 1,000 people, I think it's like about 900 people who are eligible for, who would be eligible for parole within a year. Over a third of them have been paroled at one time, violated their parole, and that's why they're back in our correction system. So you need to keep that all in perspective when you're thinking about the small minority of people who are calling to release our inmates. Next, I'd like to just update everybody on PPE. Last night when I was on NET, I had mentioned that we'd spent about $275,000 on PPE. That was actually a number from the beginning of the week. I've got an updated number now now that we're at the end of the week, with regard to that. We've spent about $1.2 million on PPE that we have received, and we're of course looking to do more. So I think we've received something like 1.9 million gloves, about 900,000 surgical masks. We're getting the ballpark there. So we'll have some more PPE that is coming in, and as we get that PPE, we are distributing that out to people. I take it back, it's about 240,000 surgical masks. But we are getting more in. We're looking to distribute more out. We've got not quite 300,000 N95 masks. So as we get that in, we will be getting that out to the local public health departments to distribute to the folks who are hospitals, first responders, volunteer firefighters, healthcare clinics, nursing homes, and so forth, to be able to help protect the workers and the general public. So we will continue to get more PPE here in the state to go forward with that. Also want to mention the Restaurant Association is working to help out people in the industry that have been impacted. The restaurant industry is probably one of the most heavily impacted industries here in our state and across the states. There's a website out there we refer you to, nebraska.openforbizus.com. So Nebraska spelled out, .open for, as in the number 4, biz, B-I-Z-U-S.com. So refer you to that, to how you may be able to help out. Next week, with regard to these briefings, we will do Mondays at 1 p.m., which will be 1 p.m. Central Time, which will be a change from what we normally do at 2 p.m. Central Time. That is because I have my radio call-in show, which is the longest continuously running radio call-in show by a governor in this country. Not only me, but going back for a number of my predecessors. I think it goes back past 25 or so years. And that is at that radio call-in show will be at 2 o'clock Central Time on Monday, and so we'll move this press conference up to 1 p.m. Central Time to be able to accommodate for my radio show. And then also next week we'll be doing the NET the television town hall. Again, same time, 8:30 Thursday. I'll be on with probably some other guests as well next week too. So with that, I'm going to go ahead and go into the Q&A. And I know we've already got some questions for Scott, so I'm going to hold those off and let him come up and talk about those. And then so when I get through some of these, I'll turn it over to you to talk about some of those. So, Henry Cordes from the Omaha World Herald: some small churches plan to meet for Easter services while keeping in groups of 10 or less. While it might be allowable within directives, do I think it's advisable to bring together unrelated people in this way? Would I advise them from doing something else? Again, we really encourage people to, as you celebrate the Easter holiday, celebrate it within your household. But I also understand that this is the most important Christian holiday of the year. And we want people to take those steps to keep properly social distance. While they're doing it, I'd encourage people to stay home. But if people are doing church service with 10 or less, that is allowable under the guidelines. Andrew Mim from KGFW talks about the state, hey, we're doing this whole 21 days to stay home and stay healthy. We're really putting a focus on this last few days. If we're looking that the end of April is going to be a peak for coronavirus, why shouldn't we just go ahead and push back the election or go to all mail or something like that? Again, this country has voted through pandemics in the past. It's voted through wars in the past. In fact, we held our election in the War of 1812, even though Washington was burned in that year. So we are going to go forward with the election. We are encouraging everybody to use their early ballot request form that's been mailed out, that green card, fill it out, send it back in. I know a number of people have already taken advantage of sending that card back in to get their early ballots. Those forms are due May 1st, so if you get that filled out before May 1st, you can receive your ballot in the mail. You can fill it out, mail it back in, drop it off your county box. We certainly are encouraging that, but we are not going to disenfranchise voters by closing polls. That would disenfranchise voters. So polls will be open on May 12th, and we're not moving it back. We're going forward with the election May 12th. Dale Johnson from KFOR, should state teammates be working at one state facility, then travel to another state facility in different communities, in different counties, working 2 days a week in Lincoln, then maybe going to Beatrice for 3 days or something like that? Yeah, again, that's part of your job function. That's all perfectly appropriate. Again, we want employers to take good steps to be able to do social distancing and protect people, but we understand some people's jobs just don't always allow for that, and that's okay. Just we want people to take those good social distancing guidelines, that physical distancing, to make sure that we do all we can to mitigate the spread of virus here in our state. And then he also asked, how do you plan to reimburse essential staff that are excluded from the federal leave program to take coronavirus time off because, say, their children are not attending school? Again, obviously, staff have their paid time off. We also have an extended leave program, or rather, a prepaid leave program, so to speak. We have loan programs that people can donate their leave and other people can use them. So we have a variety of different ways to be able to handle that. And then Joanne Young here has a number of questions, and these, I believe, these are all for the Director Frakes, really, to answer. Taylor, is there anything else that is not corrections related that I should hit upon?
I have a few other questions from people that have texted in.
Okay, so not correction ones, though, so we'll leave, you can say those for Scott.
Okay. No, these are non-corrections.
Non-correction related, great.
Melanie from Canopy wants to know what is available for sole proprietors or self-employed people to help them with their business.
Melanie wants to know about, from KNOP, wants to know what's available for self-employed and contract workers?
Self-employed or sole proprietors.
Self-employed or sole proprietors. So there's a number of alternatives out there for folks. First of all, if you are in one of those categories that you've got your own business, the Small Business Administration has a number of different loan programs out there available to be able to help you get that loan. So for example, there's the Paycheck Protection Program, which is a forgivable loan program that you can take out a loan as a small business, use that to keep your teammates on board, and then if you do that and keep them on board, you can then have that loan forgiven. There's another type of loan that will allow you to cover other types of expenses. You can't double dip on that. You can't use both for the payroll, but you can use them for different types of other, say, capital expenses or not capital expenses, but other type of expenses you may have that are not payroll related. Also, when it comes to unemployment benefits under the CARES Act, people who would not typically be covered by the unemployment insurance program are covered under the CARES Act, so that if you close down your business, you would be eligible to get that pandemic emergency assistance unemployment program. So encourage you to go to the Department of Labor's website to apply for that. I do want to point out, though, if you've not typically been able to access the unemployment program, you have to go through the unemployment application, get rejected. I know this sounds crazy, but this is how the government works, right? You have to get rejected, and then you are now eligible for the pandemic unemployment system. And so you just have to keep pushing through that process, but it's not, it's part of the process. You have to get rejected for the regular unemployment program to be eligible then for the pandemic unemployment program. So just keep that in mind as you're going through that process.
Mike Patterson with the World Herald would like to know, does the direct health measure that shuts down club sports include pick-up basketball games?
So the question was from who?
Mike Patterson with the World Herald.
Mike Patterson with the World Herald. Does the directed health measure that prohibits club sports through the end of May prohibit pick-up basketball games? And again, it's one of those things, folks, we really want people over these next 21 days especially, stay home. Find that social distancing way to exercise at home or a social acceptable way, but we're trying to slow the spread of virus. So a pickup basketball game that, for example, has less than 10 people would be allowable under the directives, but folks, what we really want you to do is think about the spirit of the law here, right? We're really trying to get people to stay home the next 21 days to slow the spread of virus in our state to really knock it down.
2 questions from Martha at the World Herald. has the government given any indication of when they may be able to complete the review of Nebraska's Medicaid waiver? And that is, how long will people have to go without the extra benefits they'll get under prime coverage?
So Martha Starr from the World Herald asks about our Medicaid expansion program. Department of Health and Human Services put out a press release saying that the Center for Medicare and Medicaid Services has told us that because of coronavirus, they will not be able to complete our 1115 waiver approval by April, like it was previously scheduled, and they've pushed us off for about 6 months on that. And so that means that we are going to be going forward with Medicaid expansion. We will start taking applications August 1st. We will have that program in place October 1st, but it will only be the basic package and not the prime package, except for people who are newly eligible 19 and 20-year-olds, pregnant women, and medically frail people who will be able to get that prime package. Everybody else will start with the basic package. Again, and that's, we've been told we've been pushed off probably roughly 6 months with regard to getting approval for our 1115 waiver from CMS.
Did the federal government indicate whether there was a problem with Nebraska trying to eliminate retroactive coverage in its Medicaid waiver?
That's also from Martha. So did the federal government indicate there was any problem with doing away with our retroactive coverage for the Medicaid expansion? So the answer is no, they didn't say there was any problem with that. They just said they weren't going to honor that as part of our 1115 waiver, and so that has been removed from our 1115 waiver.
You might also explain what the 1115 waiver is.
Oh, okay, right. So the 1115 waiver we're talking about is the waiver that we submit to the federal government. We actually submit it to the Center for Medicare and Medicaid Services in December, and that is the waiver to allow us to go forward with our Medicaid expansion program. So it basically lays out our program, which has 2 tiers. Everybody gets the basic tier, and then the prime tier, which is additional coverages such as eye, dental, and over-the-counter drugs, is available for people who are doing things such as either volunteering a certain number of hours a week, going to school, taking care of a family member, working, additional sorts of things that we want to encourage that kind of behavior. And that prime coverage is part of the overall 1115 waiver we submitted, but as I said, CMS has said they're not going to be able to get to that in April like they had originally planned because of the coronavirus, and so they pushed us off roughly 6 months, and so we're going to just go ahead and launch with the basic program, which doesn't require the same level of approvals, and we've got the ability to get that done and still stay on schedule with August 1st and October 1st.
Don with the Journal Star wants to know if you've been in contact with Senator Vargas about his safety concerns for meatpacking plants.
So the question from Don Walton, the Journal Star, have I been in touch with Senator Vargas with regard to Senator Vargas's concerns about the health and safety of folks at meatpacking plants? I have talked to Senator Vargas, but it was really with regard to his father, who is sick and in a hospital in New York, and you can imagine just the trying conditions there where not only can Senator Vargas not go to visit his father, but none of his family in New York can actually go visit his father in the hospital. So they're having a very tough time, and so I'd encourage everybody, please keep Senator Vargas and his family in your prayers, especially over this holiday weekend. With regard to the meatpacking plants, I have, however, been in touch with JBS every day this week except today so far. I've been talking to an executive there. They've sent me some of the things they're doing with regard to keeping their teammates safe there. Everybody's wearing masks. They've got a number of things where they're doing sanitation, cleaning things down. They're taking the temperature of everybody who's coming into that facility. At the beginning of the week, I think they were using thermometers. Now they're using infrared cameras to make sure that everybody coming in does not have a fever. They're telling people if you're sick, go home. Everybody in your household needs to stay home. They're translating that. Not only do they send out flyers every day in English, but they also have it in Spanish. They're writing it up in Arabic, and I actually had to ask one of the executives. He sent me the documents, and I'm looking at it, I'm like, what language is this? It was Somali. So JBS is making just great efforts to be able to communicate out with their folks in multiple different languages to help them understand the importance of really making sure we're doing all we can to slow the spread of virus, and what JBS specifically is doing. They're also putting up plastic partitions in their lunchrooms so that people can eat individually, kind of think of like eating within a phone booth almost. They're spreading out their lunchrooms. They're having people setting up picnic tables outside, turning in conference rooms into lunch facilities and so forth. They're really doing a lot to make sure they can social distance as much as possible. They're putting up plexiglass walls between workstations on the floor as well. So that's a work in progress. So JBS is taking a number of steps to be able to help protect the health and safety of the folks that are working there at that plant in Grand Island. And I've also talked to a number of the other employers in Grand Island as well, and they are all, at least the number of the large employers, and they are also taking similar sorts of steps to be able to protect the health and safety of their folks, as well as slow the spread of the virus here in our state.
The rest of the questions are for Scott.
Okay, the rest of the questions for Scott Frakes. So Scott, I'm going to turn over to you.
Governor.
Start with that first one right here, Joanne, right here, yeah.
So, from Joanne Young, Lincoln Journal-Star. Is there a plan to test all staff who have contact with inmates? At this point, no. As I said before, the right approach is to test when medically indicated. So we're working with, I have an excellent medical director, Dr. Deal. He is in contact with Lincoln Lancaster Health Authority, as well as officials at the state level. And if it's medically indicated, we won't direct staff to be tested. We will tell them if there's a reason that they're symptomatic, that they should go home and recommend that they do be tested and they contact their healthcare provider. And at this point, that is our plan. Second question was, do you have a place to isolate inmates who are symptomatic? Have you been able to set aside any beds for that purpose? So yes, we do have places in all of our facilities to both quarantine and isolate, depending on the situation. And again, as I talked about before, I don't share specific details on where those beds are located or what the plan is around those beds, because there's security concerns. And a concern has been expressed by staff at the penitentiary that social distancing is not being followed, especially in units 6, 7, and 8. Also, if someone is infected, no plan has been communicated to staff or inmates how the department will deal with it. So the first part of that question is specific to units 6, 7, and 8. Those are dormitory units, basically 100 beds per dormitory. And so yes, there is space confines. It is difficult to consistently maintain that 6 foot of distancing. We have provided the barrier mask to all staff and all the men that live in those units. That will help greatly with that spread of airborne droplets. We've directed people that they're to wear the mask anytime that they're not sitting on or in their bed, and recognizing that there'll still be situations where that 6 foot distance will be difficult to attain. We recognize that, and if you think about it, there are lots of other situations in our society where it's not always possible to do that. We want to make sure, though, that we are paying attention to what's going on, making sure that if there's anyone that appears in any way to be symptomatic and has not asked for help, and we made it very clear to the population, if you don't feel well, tell us. We don't really care what it is. If you don't feel well, tell us. We're going to immediately follow up and make sure that whatever the need is addressed. And then on the piece about not communicating to staff, well, it's not true. We have communicated, we have shared information with staff. We make sure that the staff have the information they need to do their jobs. There are times when staff would like to know more, feel that they just would like to know more, and I can understand that on occasions. There's even times when I'd like to know more. But as I tell people, need to know doesn't mean you always just need to know. Sometimes there's a want to know and a need to know, and it's really important in our business that we identify who it is that needs to know, what it is they need to know, and we get that information in their hands, and we're doing that and doing it well. And the last one, is there a shortage of cleaning supplies in some prisons? Again, we do a phone call every morning with all of the wardens, 8:45. Typically lasts a half hour to 45 minutes. We go over staffing levels. Are there anybody that's presenting symptoms? Has anybody staff tested and positive or presumptive? We work down a pretty long list of things that we want all of them to report out on. Sanitation supplies, paper supplies, food supplies are all part of that as well. There are no shortages reported in any of our locations.
There's a few questions that I just put for you, Director Price. I need to repeat them after I give them to you. The first two are from William Padmore from KLIN, and he asks, have any inmate activities been canceled or restricted?
So I got Mr. Padmore.
KLIN.
You speak fast. KLIN? Sorry, I don't know all the media outlets. Yes, starting with,
Repeat the question.
he asked, has there been any inmate activities that have been canceled or did he say modified or just canceled? Restricted or canceled. So yes, the most significant would be access to family members. We stopped family visiting a month ago. To attain that 10 people or less in a space, we had to reduce classroom sizes, recreation grouping sizes. So most everything has had some level of impact in terms of the size and the number of people that can be engaged at any one time. We've then been able to still deliver what we need to deliver by using technology, by doubling up and using 2 classrooms instead of 1 so that we can break it down into groups of 10 or less, and other approaches. Some of our outside providers, our volunteer programs are a good example. We stopped allowing in the volunteers at the same time as our inmate visitors. So any of those volunteer-led activities have all stopped. I think that's, the inmate clubs are meeting on a very limited basis, and in some facilities probably not at all.
His second question is, are the corrections department's emergency plans secret to prevent inmate backlash?
Well,
Repeat the question.
are the emergency, are the department's emergency response plans secret to prevent inmate backlash? That's a piece of it. I think I spoke to that in that, unfortunately, people will read more into them, or they will make assumptions about what we're saying, or they may read it exactly correctly and realize that it's going to impact them in some way that they're not happy about. And again, you don't have to look very far to see that demonstrated. I believe it was only yesterday or 2 days ago in a facility on the West Coast. So that's a piece of it, but it's also, we have a lot of stakeholders. I have staff. Number one, it's always my top stakeholder. They've got to be informed, they've got to know what's going on so that they have the information and the tools so they can do their job, so they can carry out their piece of the plan. Almost always, there's then some part of it that we have to get communicated to our population. So we need to make sure that we do that in a way that's effective, that gets out consistently so that everyone gets the same message. Same thing for staff. And then it's important that we inform all the external stakeholders as well of the piece that they need to know. So that's as much to me and part of why we manage our emergency response plans so closely. Because if we don't control it in terms of the message, the staging, the release of the information, it creates confusion, it leads to failure.
We have a question from Kelsey at NET. She asks, is there a protocol in place for if the virus spreads to inmates? Would testing be similar to testing at the YRTC in Kearney?
So from Kelsey at NET, is there a protocol in place if inmates get the virus and it spreads? And the last part was similar to YRTC. Not knowing all the details of the YRTC plan, I'm not going to try and draw comparisons. Short answer is yes. We have a pandemic plan and a COVID-19 plan. We have ways to stage, to increase, to move people, increase resources, move people, address it as it might develop and unfold. There's just so many variables that there again, our plan has a certain amount of fluidness to it, because if it's one inmate at one location, then the response is pretty easy, we isolate and can move very quickly. If we suddenly find ourselves with 5 different inmates in 3 different locations, now we've got new complexities to add to it. So yes, we have a plan. No, it's not a plan that I'll publish.
Those are all the questions I have.
Okay, before you leave, Scott, does anybody else, so for media in the room, why don't we just go ahead and continue with questions for Director Frakes? So any media got questions specifically for Director Frakes on corrections?
Yeah, what is, you said you have a place in every prison now to quarantine and isolate inmates, right? How long ago, when was that established? When were you able to do that?
All right, so I'm supposed to repeat that Paul Hamill asked, confirming that we have a place in every facility to quarantine, to isolate, and to provide for the needs of inmates that are symptomatic or infected. How long ago was that? Well, in some respects, I'm going to guess 10 years ago, roughly, when the first version of the pandemic plan was put together. But again, it's a fluid plan, so we have the basic structure, and we know at each facility where we would start, how we might shift things depending on the number of patients or number of suspected patients that we have to deal with. And again, I'm not going to give any more specific details about what that is.
What the capacity you would have in isolated quarantine?
Roughly 5,800. My entire system could become quarantine if that's what we needed to do to safely operate.
And would it be easier if your prisons weren't overcrowded?
So here again, I've talked about this many times. The issues aren't where they sleep. The issues are, some of the spaces that we have outside of those sleeping areas. So when we have fewer inmates, does it help with social distancing? Yes, absolutely. Where we have locations that have cells instead of dormitories, certainly that helps. But with the procedures, the practices, the personal protective equipment that we've provided, we're really doing a great job of achieving that combination of reducing risk factors. So the distancing, stopping the droplets, sanitation, wash your hands, clean your area. People dedicated to just walking around with properly diluted bleach solution and clean cloths, washing flat surfaces, doorknobs, rails, nonstop. So it's all those factors that, for us, make it manageable given the population we have.
And maybe the governor can weigh in on this question too. Why are states like Iowa, which is pretty similar to Nebraska, how are they able to release some at-risk inmates in Nebraska and not?
So again, Paul Ham will ask, why are some states, specifically Iowa, able to release some inmates? And it just happens I did have contact with the director from Iowa. We were able to speak for a little while. The part that she shared with me was some of what was announced, talked about, shared, were people that in our system would already be out. They have a little bit different approach. People are granted parole, and then they still do work before they actually send them out into the community. So that was part of that. I saw a number of like 700 people, I think it was. I don't have the other factors. So for me, I've got two issues. One is I don't have the resources that this agency once had in terms of having parole administration. When the agency had parole administration, I had more ability to take care of the people I'm responsible for, whether they were in the community or inside a prison setting. That changed in 2015. So I do not in good conscience have the ability to hand people off to someone else that are still my responsibility. But really, more important to me is the public safety issues. And it's twofold. We don't need to make quick decisions to push people out that then may create more victims. But probably my strongest point at this time is this is not a good time to be coming out of prison. I can offer housing, climate-controlled housing, food, clothing, recreation and work opportunities, good health care, programming, and in a relatively safe setting. And unfortunately, right now, for many people that leave prison, they're going to be very challenged to find those things.
We have two questions from Grant Schulte. The director of Riggs. Has the virus affected how new staff hires are trained?
From Grant Schulte, asking about new hire staff training. That's a great question. Yes, absolutely, because there again, it's important that we continue to hire. We're really starting to feel some good progress. We're seeing downturn in our turnover. Now we've got bigger applicant pools, and we expect that those applicant pools are going to continue to increase. So I want to bring on people to fill the vacancies we have, but have got to do that safely. We reduced our class sizes. We're using video and WebEx or web tools to deliver content. We've stopped certain parts of the training component that required physical hand-on contact that we felt we could delay and deliver at a different time when it was safer. So yes, we've done some pretty significant adjustments to achieve that social distancing, that safe amount of contact, and even there, everybody's wearing their barrier mask, as we are in our headquarters building.
Secondly, are you seeing an uptick in applications given the rise in unemployment?
And that was from Grant as well. And yes, it's a little soon, and yet we felt like we started to see an uptick fairly quickly, and the numbers continue to increase, and I would fully expect that those numbers will continue to increase. I ran through very similar experience in 2009, 2010.
Fred, Frank's,
Oh, go ahead, Fred. Go ahead.
just before this news conference began, the ACLU announced that they had asked for an emergency order to force you to disclose your COVID plan. And they said your refusal to do this raises concerns about the quality and the extent of the plan. What would be your response to that?
So Fred Knapp, and the question is about the ACLU requesting, raising, I haven't seen it yet.
Emergency order.
Emergency order, for me to, I'm sorry.
Litigation.
And it is, and that's the thing. So the question is about ACLU asking me to release the COVID-19 plan. And I'm in active litigation with the ACLU, so I can't comment on anything related to what they bring to me.
Okay. Also, have you seen an uptick in staff absences due to this coronavirus situation?
A little bit,
Read
not,
the question?
I'm sorry, Fred Knapp, have we seen an increase in staff absences or vacancies, staff absences?
Calling in sick, that sort of.
Yes, so people calling in sick due to the virus or whatever the issue might be. So between some increased childcare needs, some people that were, secondhand exposure or a family member was exposed or something, self-quarantining, and again, some people that were symptomatic in some way and made the wise decision to stay home until they could find out whether or not, in fact, it was COVID-19. Yes, we talk about that every morning. We take the numbers from every single facility. So far, it hasn't driven any situations of where we've had to have any significant impact on operations. So,
Can you quantify it as about 5% or 10%?
oh gosh, it would be, this morning, I'm gonna say we probably had about, for the agency, it would be maybe 2%. For protective services, it's probably more like 5%.
Andrew had a question.
Director Frakes, when you did your investigation with the staff person, how many inmates did you test? How many staff people did you test?
So in this case, our medical director, Dr. Deal, reached out to Lincoln Lancaster Health Authority, had conversation, they reviewed the situation. They noted the fact that at that point, the employee had not been in the workplace for 10 days. And after conversation, the decision was that there was not a need to do additional testing. No one else was reporting any symptoms. No one was symptomatic that had come to our knowledge. So, and then as I say, today is day 15 since the employee was last in the workplace, and we still don't have anyone that's presented.
Another recommendation from the CDC was to suspend or try to suspend some work release or to, test. What have you done with work release?
I didn't repeat your last question, I don't think, Andrew. So you ask about what the CDC recommends looking at work release, potentially suspending it or at least making adjustments. We have made some pretty significant adjustments. They were the first of the population, the inmate population, to go into the cloth mask. But probably at a greater level was we took a very hard look at what are they doing. We reached out to every single employer that employs our people in work release. We said, what's your plan? Do you have a plan? We found, I think with two exceptions, that they all did have some kind of COVID plan that was fairly consistent with CDC for employers. And then we asked the question of whether or not we thought what they were doing was essential, but at the same time, with what's been going on, there's a few people, unfortunately, that ended up unemployed because their employers were not deemed to be essential. And I think today we probably still have about 250 people roughly that are going out on work release. And then we also have our detail crews that provide services to the Capitol, to State Office Building, to my office building, to the outside the perimeters of all of our correctional facilities. So essential services, really essential, especially with the sanitation piece. So, so that's the decision we made. So we gave them masks, we stopped other opportunities for uncontrolled interaction to the best that we could. We limited, and we had already stopped visits. So we're basically their lives are very similar to yours and mine, or at least I know what mine is. I go to work and I go home. That's it. That's what I do, and that's what they're doing.
We have time for just a couple more questions.
I had one in regards to the direction and like insight you've given to your employees in the facilities in terms of, have you given them the idea of just literally go to work and go home like you're saying, or has there been any extra push to really not step outside of their house, go to the grocery store, or whatever it may be, just to avoid contracting it into the facility?
That's a great question, but I don't know your name.
My name's Lee.
Lee?
Yeah.
So Lee asked if we've done anything to tell our staff, not just about what we need for them to do at work to be safe and to keep each other safe, but are we sharing with them the need for them to do that in the public, in their homes, in their lives? Absolutely. I would say just about, I think every message that I put out, I speak specifically to that. Come back to the same basic things of don't wash your hands, don't touch your face. I probably touched my face since I've been standing here. To social distancing, and now really just mirroring what the state efforts are. Stay home, stay safe, be with your family. That's how you're going to keep yourself safe, you're going to keep your family safe, and your coworkers and the other people that we're responsible for. And we also have shared information that would explain to people the need for them, kind of a reminder of something that we have been telling corrections workers now for almost 40 years. It was just starting to kind of come to life when I started in this business. And that's be really thoughtful about what you're wearing and how you process that. So, have some procedures so that when you get home, you can put your clothing in the washing machine. You can take care of your personal equipment in a way that doesn't potentially spread contamination to others. So it's just some of a lot of the information that we're sharing with staff.
We have time for a final question.
Director, going by NSP today, out in the yard, a lot of prisoners working out, walking around, very close quarters. Do you have a plan in kind of making sure that they're practicing social distancing out in the yard, and can you really control it?
Well, that's what part, I'm sorry, and you are?
I'm John from KMTV.
John, KMTV. And the question is, you would notice at the penitentiary out in the recreation yard that people are still doing what we don't want them to do, and that's get too close to each other, gather together. Trying to find that balance between, again, making sure that I can give people some out-of-cell time, because that's going to lead to the healthiest outcomes for everybody, and recognizing that we're dealing with a population of people that aren't known for a lot of compliance and following the rules and those kind of things. So staff continue to remind them. I've got staff working hard to not do just the typical, hey, you're not supposed to do that, quit it. But, do you understand when you do that, you're putting yourself at risk, you're being put at risk, and then maybe you put me at risk. So continuing to reinforce that message, trying to avoid using the information, the education, as opposed to the hammer of, now we're going to punish you because you won't do this. The other factor, too, is for our population, because there is no one that is symptomatic, no one has neither produced symptoms or demonstrated symptoms or actually been diagnosed with the disease. At this point, they're a pretty contained and isolated population. So it's the people coming into the prison that bring the greater risk today.
Great, thank you, Scott.
Yeah.
Well, again, folks, thank you all very much for being here this afternoon. Just a couple of final points as we wrap up here today. First of all, I want to remind everybody about our 6 rules for staying healthy, especially over these next 21 days as we really focus on knocking down the virus here in our state. We want you to stay home, no unnecessary trips outside the house. We want you to work from home if you can, but socially distance at work if you wherever possible as well. We want you to go shop, but only shop once a week and don't take the entire family with you. Go by yourself. We want you to help kids. Number 4, help kids with regard to social distancing. Have kids play at home for the next 3 weeks. Avoid playgrounds and large, team sport type activities. Help elders. Help the seniors, our older Nebraskans. Maybe you can go shopping for them, run errands for them, help them stay at home, but don't go visit long-term nursing facilities. And then finally, exercise. We were just talking about that with the yard. Get out and exercise from home or with a socially, appropriately socially distanced type of exercise. All these things will help us slow the spread of virus here in our state. That's going to be so important as we focus on these next few weeks here in April. This is when we should reach the peak of the spread of virus here in our state. We want to knock that down so we don't endanger those people who are most vulnerable in our society and that we don't overwhelm our healthcare system. As these charts show from Google, we're making progress. Let's stay on top of it, folks. Nebraskans have been great about this. We want everybody to exercise their, personal responsibility, because everybody can be a part of fighting the spread of virus here in our state. And then just finally, I want to wish all the folks planning to celebrate Easter, happy Easter. But please remember, celebrate with your household only. That would be the best thing to do. Thank you all, and we'll see you again back here at 1 o'clock Central Time on Monday, because of the radio call-in show. We'll be back here at a different time, 1 p.m. Central. Everybody have a great weekend. Thanks.